Good afternoon. I'm Michael Cope. Um, I'm one of the mentors at Health Wildcatters. Have been in their program since the beginning. I'm also a local early stage company investor and advisor. And today it's my pleasure to introduce to you Insight Optics. Sometimes we're drawn to companies based on them making a personal connection with us on some level. My brother nearly lost his sight to detached retinas, and I personally have had torn retinas in both of my eyes. Torn retina is the precursor to, if it's not treated, turns into a detached retina. When I was in treatment for my torn retinas, my ophthalmologist told me a story that I've never forgotten. He said that every first-year medical student is taught that the eyes are a window to health, and that with a proper examination of the fundus, the back wall of the eye, you're able to identify all manner of physical problems that may be coming up, diseases and infirmities that may eventually show up, but you're able to see them long before there's any symptoms and before any damage is done. Despite that, most people, the first time they ever have a real examination of the fundus of their eye is when they have been referred to an ophthalmologist for treatment of some serious condition that the ophthalmologist then has to try to fix. So what he told me was, we're really missing the boat. We ought to be doing fundus screenings on a routine basis, same as we do blood chemistry screenings. That's now a common part of our annual physical. He said, we really should be doing that. And he was frustrated that we didn't do that. That conversation was 5 or 6 years ago. Fast forward to just last week. I was in my annual wellness exam. I have a very good primary care guy. He asked all the right questions. We talked about what things we're monitoring. He did all of the normal measurements. We talked about, he issued orders for blood chemistry tests and all the things that we all see when we have a wellness exam or a physical exam. And what he didn't do was he didn't do a fundus exam. I noticed this, and I shared with him the story that my ophthalmologist had told me. And I said, so why is it that we don't do a fundus screening as part of a wellness test or a physical exam? He thought about that for a minute, and then he said, actually, I completely agree with your ophthalmologist. There would be great value if you were able to do a screening of the fundus every time you do a physical exam. Might even be as valuable as what we do with blood chemistries. He said, but there's 2 or 3 pretty good reasons that we don't do that. He said, first, you have to dilate the eyes. That right there is a deal killer. You can't do that as part of a physical exam, a routine physical exam. The second thing is the equipment that it takes to do this exam. First of all, we don't have it, and it's quite expensive. But the more important part of it is that the skill set of doing the examination of the fundus is actually a specialty skill set. It takes an ophthalmologist to do a really good job of it. That turns it into a referral, which leads to the third problem that I've got, and that is, as a referral, I can't make any money at doing it. So he was pretty candid that business of medicine is a business, and he can't really do procedures that don't make him any money. Those are pretty good reasons. I thought they were pretty good reasons. But it so happens that Insight Optics, their solution that they'll be talking about in a minute, overcomes all of those obstacles to doing a routine fundus screening And I believe that they're in a position, they happen to be at the right place at the right time, take advantage of some new CPT codes that are out there, some new instrumentation that's out there. They add their body of software and database and all the things that they bring to the table. I think they're in a position to actually change the game of preventive medicine. So at this point, I'd like to help me welcome to the stage Brock Webberman, who is the CEO and co-founder of Insight Optics.
Good afternoon, ladies and gentlemen. My name is Brock Webberman, and I'm the CEO and co-founder of Insight Optics. Vision loss is a growing concern in the United States, and patients with diabetes, high blood pressure, and countless other conditions are at the greatest risk of developing preventable blindness. For this reason, more than 71 million patients are recommended for annual retinal exams. Unfortunately, less than 50% of that population are actually compliant with these screenings. Now, the reason for this is twofold. On one hand, it is difficult to access the specialists that best perform these exams. There are only 24,000 ophthalmologists currently practicing in the United States, compared to more than 300,000 primary care physicians. But on the other hand, is a skill gap. While primary care physicians have been trained to perform retinal exams, they consistently rank it as their lowest confidence score among the wellness checkup. So if only there was a way that we could utilize the access provided to us by primary care physicians, but also maintain the skill of the ophthalmologist. Well, today, I'd like to introduce you to OptiView. OptiView is a mobile application and website that allows primary care physicians to record retinal exams using a handheld ophthalmoscope. We provide this ophthalmoscope to the physician at no upfront charge, and on day one, they can begin recording retinal exams in their office and saving them to our HIPAA-compliant database. But more importantly, they can connect with local ophthalmologists in their area who will analyze these exams and send back a detailed report of any findings and follow-up instructions. We currently have a subscription model that charges the primary care physician just $150 a month for our service. And what's great about the OptiView system is that it benefits everyone involved, especially for our patients, and not only increases access to these screenings, but also saves them the time and money normally affecting this exam. For the primary care physician, it not only increases the confidence that this exam is being analyzed properly, but it also introduces a new source of revenue, as they can now get reimbursed for this screening. In fact, with as little as 6 exams a month, the primary care physician can already see a return on investment. And finally, for the ophthalmologist, the OptiView system serves as lead generation, bringing in higher priority patients that on average pay more for advanced care. We've spoken with both primary care physicians and ophthalmologists who agree that the OptiView system will not only increase access to these screenings, but improve overall patient compliance. With their help, we are beginning a local pilot study in January right here in DFW. But moving forward, expanding it to California, Arizona, and Minnesota, due to the number of ophthalmologists already in these areas and the presence of telemedicine reimbursement policies. With our current target audience, primary care physicians currently make up a $540 million market, and there's room for us to expand into large hospital groups, urgent care clinics, and other specialties. We will be marketing specifically to these different sectors by utilizing the ophthalmologist and the referral networks already in place to best reach these physicians. And of course, here is how we compete. As you'll notice, we have both technical and financial advantages over our competitors. The competition currently charges for expensive, permanent equipment that does not line up with the primary care physician's spending or training. We're the only system that utilizes affordable, portable hardware that does not require any form of dilation to perform the exam. We're also the only model that utilizes local evaluating specialists, eliminating the need for full-time screening centers in each state. We've already constructed a great team both myself and my partner, Aaron Inton, received our master's in biomedical engineering from Johns Hopkins University, and are working with developers that specialize in both HIPAA compliance and EHR integration. Moving forward, we are completing our second generation prototype by the end of this year in preparation for that January pilot study. But more importantly, we are FDA Class 1 exempt, meaning that we can register and be on the market by the beginning of 2017. To complete the goals ahead, we are currently raising $750,000 to complete that pilot study, file key patent applications regarding our software, and hire full-time developers. Now, there are already 12.5 million patients in the United States suffering from preventable blindness, causing more than $14.4 billion in direct and indirect costs to the healthcare system each and every year. It is time to make a change. At Insight Optics, we like to say that the eyes are the window to your health. Now all that's left to do is look inside. Thank you very much.